All right, welcome back for another deep dive. And today we're going to be tackling two sources that seem pretty different at first glance.
Yeah.
We've got potential trade wars brewing, and then we're also going to look at proposed changes to healthcare policy here in the U.S.
Yeah, you wouldn't think those two things go together,
Right.
but we're going to see if they're maybe a little more connected than they appear.
Exactly. So stick with us on this one, folks. It's going to be a fascinating ride.
It is.
So first up, let's look at this breaking news article from the Associated Press. And this is reporting that President Trump is about to slap a 25% tariff on goods coming from Canada and Mexico,
Oh, wow.
possibly as early as Saturday.
Yeah, and I bet some people are thinking, wait a minute, I thought the trade war was with China.
What?
What's going on?
Right, and that has been a big focus.
Absolutely.
But here's the thing that kind of surprised me when I was reading this. The U.S. actually does way more trade with Canada and Mexico combined than it does with China.
A lot more.
Yeah, the article points out that in 2023, trade between the U.S. and our North American neighbors totaled, get this, $1.8 trillion
Wow.
compared to $643 billion with China.
Big difference.
Huge. So these tariffs, if they actually go into effect this, could have a massive impact on the U.S. economy.
Yeah, and, it could hit people in some ways that they're not really expecting. Like, I was reading the article, and they had this example about guacamole.
Okay.
You're getting ready for your Super Bowl party. You got to have your guacamole.
I have guac?
But those avocados, most likely they're coming from Mexico.
Yeah.
And suddenly, because of these tariffs, they're way more expensive.
Oh, man. So Super Bowl parties are going to get a lot more pricey.
That's right. Your chips and dip are going to cost you.
Ouch. And it's not just avocados. We're talking about cars, too.
Oh.
This article says both new and used car prices could jump by thousands of dollars.
Thousands.
Thousands.
And I bet gas prices are going to be affected too.
Yeah, especially in the Midwest.
Right.
Because we rely a lot on Canadian crude oil.
Exactly.
So, we fill up our tanks all the time here. So that's going to be a big...
Yeah, these tariffs could really hit people right where it hurts in their wallets.
Yeah, for sure. And it's not just consumers who are worried about this. This article also talks about American whiskey distillers.
Okay.
They're already facing tariffs from the EU.
Oh, right.
And they're saying, hey, if Mexico and Canada retaliate and also put tariffs on us, our businesses could be in real trouble.
That's a good point.
Mm.
It's easy to forget that these trade wars, they don't just impact like the big corporations.
Right.
It's the small businesses too, the people they employ. It has a ripple effect.
Absolutely. And the article also talks about American farmers.
Yeah, they've kind of been caught in the crossfire of this whole trade war thing, haven't they?
Yeah, they have. They were hit pretty hard with those previous tariffs, and a lot of them are really worried about what these new tariffs could mean.
Makes sense. I mean, this is their livelihood we're talking about.
Yeah, and there's this quote in the article from a Nebraska farmer named Mark McCarg, and he says he appreciated the government aid they got when those earlier tariffs led to other countries retaliating, but he'd much rather have open markets, He doesn't want to be relying on government checks.
Yeah, I can see that that's not really a sustainable solution, is it?
Not really, and I think that quote just really highlights the human impact of these policies.
It does.
It's not just numbers on a spreadsheet. We're talking about real people's lives and their ability to put food on the table.
It's easy to forget that sometimes when you're just looking at the big picture.
Yeah. So before we move on to our second source, I want to pause here for a second and ask you, the listener, to think about this. How might these rising prices on things like your groceries, your gas, your car, how might that affect your own life?
Yeah, we're talking about things that affect everybody.
It's important to think about how these global events, they trickle down to our personal experiences and our own communities.
Right. Yeah.
Okay, so we've seen how these tariffs could really hit us, right in the grocery cart at the gas pump. But now let's switch gears a little bit and look at our second source.
Right. We're going to talk about healthcare. And this article is from AFSCME. That's the American Federation of State, County, and Municipal Employees.
Okay.
And they're raising some serious concerns about something called Project 2025.
Project 2025. What is
That's right.
It sounds kind of ominous.
It is kind of ominous, actually. It's essentially a blueprint of conservative policy proposals that could be enacted if there's a second Trump term.
Okay.
And healthcare is a big part of that blueprint. The article says they're really worried about what these proposed changes could mean for access to affordable care.
So this is where things start to connect, right? We've got trade wars and healthcare.
Exactly. It might not seem obvious at first, but when you dig a little deeper, you start to see how these things are related.
Yeah. Okay, so let's get into some of the specifics. What exactly does this Project 2025 propose when it comes to healthcare?
Well, it suggests some pretty major changes to the system, like potentially eliminating the Affordable Care Act, cutting back on Medicaid benefits, and
Wow.
making it harder to qualify for Medicaid.
That's a lot to unpack, and the article also mentions something about increases in Medicare Part D prescription drug costs.
Yeah, that's right.
So if these changes actually happened, wouldn't that impact a lot of people?
Yeah, we're talking about potentially millions of people losing their Medicaid coverage.
Yeah.
People with pre-existing conditions could be denied coverage by insurance companies.
Oh, wow.
And the cost of essential medications like insulin could skyrocket again.
And there's more, right? Because this project, 2025, it also takes aim at women's health care.
You're exactly right. The article points out that there are proposals to restrict access to contraception, and they even talk about using this old law from 1873, the Comstock Act.
Wow, 1873, that's going way back.
Yeah, it is to try and limit access to medication abortion by mail.
Okay, so we've got these two big stories, one about trade wars that could lead to higher prices and economic uncertainty. And then we've got this other story about potential healthcare changes that can make it harder for people to get the care they need.
It feels like a 1-2 punch.
Yeah, it does. And I think that brings us back to the question we posed at the beginning of this deep dive. How are these two sources connected? How could a trade war with our neighbors potentially impact something as important as healthcare?
Yeah, that's a great question. And I think for starters, we have to look at the potential economic fallout from these tariffs. Economists are saying that they could lead to higher inflation and even an economic slowdown.
Right. And if that happens, then what happens to healthcare? We're already dealing with rising healthcare costs. And if people are suddenly struggling to afford groceries and gas because of these tariffs, won't that make it even harder to pay for healthcare?
Yeah, that makes sense. It's like a domino effect. You hit people's wallets in one area, and it impacts their ability to pay for other essential things.
Mm.
Exactly. And it's not just about individual budgets either. If the economy slows down, that could impact government revenue. And less tax revenue coming in means less money available for public health care programs like Medicaid and Medicare.
So we could actually see even deeper cuts to these programs than what's being proposed in Project 2025 because of the economic pressures of this trade war.
That's definitely a possibility. And there's also the issue of focus. Some experts are worried that all the time and energy being spent on negotiating trade deals and imposing tariffs is taking attention away from other important issues like healthcare costs.
So while the administration is busy fighting this trade war, the healthcare crisis could be getting worse.
Yeah, that's a real concern, and it raises a big question for all of us. If governments have limited resources, how should they be balancing investments in trade policy versus healthcare? What are the factors that should be considered when making those tough decisions?
Man, it can feel kind of overwhelming sometimes, when we start to see these connections between like a trade war and what it could do to healthcare. I mean, it's easy to just throw your hands up and say, well, what can I even do?
Yeah, I get that, but I really do think it's important for us to remember that we're not totally powerless.
Right.
There are things we can do both individually and as a society to try to make things better.
So where do we even begin?
Well, I think a big part of it is just being aware, like we've been talking about, understanding these connections between things that seem totally separate. At first glance, that's the first step.
Okay, so being aware.
Right, because once we see how everything's kind of intertwined, then we can start to think critically about, what are the consequences going to be when decisions are made and how could that impact other areas?
So if we're worried about these tariffs messing things up with healthcare, then we need to speak up.
Exactly. Make your voice heard.
How do we do that?
Engage in the process. Write to your representatives, go to town hall meetings, join advocacy groups that are fighting for the things you care about. Let your elected officials know that you're paying attention and that these issues matter.
Okay, so don't just sit back and complain, actually do something?
Right, and it's not just about reacting to what's already happening either.
Okay.
We can be proactive,
Okay. How so?
I mean, when it comes to healthcare, there's so many great ideas out there for making it more affordable and easier for people to get the care they need.
Like what?
We need to support research,
Yeah.
new treatments, new ways of delivering care, and we need to invest in things that keep people healthy in the first place, preventative stuff.
Right. Okay, so that's big picture stuff. What about on a personal level? Is there anything we can each do to sort of navigate this?
Oh, for sure. Absolutely. I mean, focus on healthy habits.
Okay, eat your veggies.
Right, exactly. And manage your stress, stay informed about your health, and be your own advocate.
Okay.
Take charge of your own health and well-being as much as you can.
Yeah, that makes sense. But I keep coming back to this idea of balance. Like, is there a way to promote economic growth, through trade and all that stuff, while also making sure that everyone can afford healthcare?
That's the million-dollar question, isn't it?
Yeah.
There's no easy answer. It's complicated, and we have to be smart about it.
Yeah.
We need to recognize that a healthy economy and a healthy society kind of go hand in hand. It's about finding a way to make things work for everybody, not just a select few.
Yeah, finding that balance is going to take a lot of work and a lot of open discussion.
It will. It will. But it's a conversation we all need to be a part of.
Well said. Well, as we wrap up this deep dive, we want to leave you with one last thing to think about. We've talked about how economic policies can impact healthcare. What about the other way around? How is our healthcare system the way it is right now? How is that maybe affecting our ability to compete in the global market?
Oh, that's a good question.
Yeah. Are those rising healthcare costs actually holding us back?
Hmm. That's something to think about.
Yeah, it seems like every answer just leads to more questions, but that's what makes these deep dives so interesting, right?
It does. It does.
We hope this conversation has given you some new things to think about, the relationship between trade and healthcare and the choices that we face as a society. It's complex stuff, but it's important. Thanks for joining us.